see the end of taking pain-killing pills. A new technology is harnessing your own body's natural healing power to help manage pain. Here to tell us all about platelet-rich plasma therapy, Alvarado Hospital's Dr. Joseph Aiello. And it's fascinating stuff that you yourself has had it done.
Sure, yes, it's an exciting new technology that it's been around for about 10 years, and initially the plastic surgeons and some of the oral surgeons had developed it because they found that it helped the body to heal better when they did reconstructive surgery. But what we do is we use a component of the patient's blood called the platelets, which have the healing factors in them, growth factors, and we actually extract that out and concentrate it. And then we inject that into a painful joint that the patient may have. And we can do many different joints. We can do anywhere from the neck down to the ankle. I actually had it done on my ankle. And it tightens up the joint and relieves the pain and the discomfort. And what it does, we use the patient's own blood to treat it. And we can do any kind of injuries from acute. I did an 18-year-old soccer player a couple months ago who had injured his knee in November, and about 2 months later he came to me and we did an injection into the knee, and a month later he was back to the sport without pain and discomfort.
It's so remarkable because, you know, there's so many sports injuries or just so many life injuries. To be able to have a treatment, and sometimes just one, and be cured, it's pretty life-changing.
Right. Until now, conservative treatment involved medications, physical therapy, and a lot of patients don't want to take medicines for the rest of their lives. And now we have a new therapy that's not invasive, like a surgery, and a lot of patients will heal after one shot, and then some people may require 1 or 2 or 3.
For folks that are watching, for our viewers that are watching today, they may think, sign me up. Let's talk about who would be a good candidate for that, and who may not be such a great match.
Basically, I've done 18-year-olds to 80-some-year-olds, and anywhere that an acute injury or a chronic injury, arthritis type injuries, we can heal, we can help the patient get out of pain with all those injuries. A person that may have had a severe herniated disc or a ligament that's been cut, like in a rotator cuff with a complete tear, those don't work. But anything in between, less than that, I've had great success.
Now, it's interesting because you were saying that you had it in your ankle. Tell us about your injury and how this worked for you.
I had broken my ankle, actually the bone above the ankle, and the ankle had been sore for about 4 or 5 months. And I had my partner inject into the ankle the platelets, the platelet-rich plasma, and it actually tightened up the ankle and reduced the pain. And when you tighten up that joint, that helps the body to heal that joint and actually relieves that discomfort.
It's amazing. And keeping it all in the family, you know, you treated your dad too.
I did. My dad had golfer's knee, the inside of the knee, and had it for a long time. It actually stopped him from playing for a while. And so I said, Dad, come on, let's do it. Let's take care of your knee. And one treatment, and he was a lot better. This
is so helpful to so many people. Talk about the expenses and if it's covered by insurance.
Well, insurance covers it. Most of the insurances have covered it. I think they recognize a potential to do a therapy to keep people from having surgery down the road.
Yeah, it would save them money.
A lot of money. A lot of money when you're talking about a joint replacement at $50,000. And you can treat anyone, basically.
So basically, how you were saying is you do an injection into the joint.
Yes. What is it's about a 30-minute procedure, and what we do is we draw someone's blood, goes into a special unit that's put into a special centrifuge that concentrates the platelets, and then we pull that part of the blood components out, and we inject that after numbing the patient very carefully and gently. And we inject that in, and that's what starts the healing cascade that eventually it increases the blood flow in the ligaments, because that's one of the big reasons why ligaments don't heal. It also after a certain time brings in stem cells that actually remodel the ligaments.
So folks are watching today and they may think, holy cow, sign me up, I want to try this. Again, it's got an abbreviation.
PRP, for platelet-rich plasma, PRP, and they can go online and look up where to find PRP being done wherever they are. It's very exciting. I think it's the start of a whole new type of regenerative type therapy.
Absolutely. So Alvarado Hospital, of course, you offer this service.
Sure.
And it seems like it can, like you said, from 18 to 80, it can really help a lot.
This is actually an in-office procedure. that the
30
patients
minutes
come in,
out,
they're
bada
in
boom,
and out.
bada
Right.
bam. Wonderful.
Yeah, exactly.
Okay. Well, Dr. Joseph Aiello,
Thank you for having
so
me,
much
Renee.
for joining us. And,
Thank you very
My
much.
gosh, so your ankle is good?
It's no problem.
Your dad's golfer knee, he's back on the
back
course.
to golfing. Yeah.
Great. Good
Yeah.
to have you today.
Thank you.
Thanks.